Well, hello everyone. It's a pleasure to see you. I'm Dr. Isabelle Amigues, your friendly rheumatologist, and we are live to discuss gout. And gout is going to be a very important topic because we are very close to Thanksgiving. And so at Thanksgiving, we have this tendency of eating a lot of meat, a lot of high protein content food, and that can cause flares up. And so today we're going to learn of how to prevent those flare up, what to do in case you develop a flare up, and most importantly, if you do not have gout, I'm going to ask you to stay because I want you to teach anyone that may have gout at the table so that you know what to how to diagnose gout, and you can give a couple of informations to people so that they can go through this. So this is in preparation of Thanksgiving, okay? So gout is a very, very inflammatory arthritis where basically there is a release of uric acid that's a crystal, and that crystallization causes severe inflammation of the joint. Very often, the first joint that's affected is the first toe on the side. So that's called the first metatarsal phalangeal. So it's the side of the first toe, at the base of the first toe. And it's usually red, swollen, extremely painful. So painful that even the touch of a sheet will be like the worst pain they've ever experienced. If there is this type of pain at that area, that's usually gout. It could be some other thing, some other crystal arthropathy, but we're going to say for the purpose of this live that this is what's happening, right? That there is this podcast, this is gout. So if someone at the table is saying, oh man, I should probably not eat that much turkey, or I shouldn't eat as much as I am eating today, ask them what's happening. And then if they tell you like, well, I think what's gout, you can tell them like, well, do you have, does it affect your first toe? If yes, they probably have gout. And then there's a couple of more questions, which is like, have you started diuretics? So diuretics are a treatment to get some fluid out of your body. And it's usually for hypertension or for heart failure. Or like if there is like too much water retention. So we may give a diuretic. So are you on that? Because that actually can cause gout flare, okay? And so that's like the first thing. Is there any new treatments? Have you had any new treatments, okay? And then the next thing is, well, let me tell you some of the things that Dr. Amigues has taught me, okay? So the first thing I want you to know is that it's 2025, almost 2026, and you should not restrict yourself. Okay, this is probably, I know you've gone and you've seen your rheumatologist, and the rheumatologist or like your primary care physician, and they're telling you, well, you know what? You should be on a low purine diet, and that's it. And then they're like, yeah, come back and see me when you have another flare. And that is wrong. Because the truth is that if you have gout, it's not just because you're a gluten. That is actually not true. It's because from a genetic standpoint, or maybe medicine treatment, you have more risk of developing gout, right? You can eat exactly the same thing than someone else, and you will develop gout, and that other person will not develop gout. You're just more at risk. And the really good news is that we have treatment for that. So so this is, if like those are the questions you have to ask. If you have had more than 2 or 3 flares in the last year, it's time for you to get treated for gout more than just the gout flare, okay? So I'm going to teach you how we treat gout flare, how you can treat your own gout flare, and then I'm going to teach you how we make sure that this never happens again, okay? That's important. And honestly, you should not have to worry about what you're eating. You should have a totally normal life where you're being treated, and you don't have to deal with what are you eating? Like, yes, what you're eating is important, but at the end of the day, the problem is that by telling you start eating less protein, that's not good for you in the long run. You want to have protein so that you're building muscle. So if I'm telling someone that's over 50, well, eat less protein, that's actually unfair, because we want you guys to eat protein after 50, because we know that it takes more protein. Like, we need protein to build muscle, and we're losing muscle with age. Okay, so that's really important, and that's why I'm telling you, we're in 2025, almost in 2026, we have treatment. Okay, now you're at the table and you're looking at this meat and you're like, okay, can I actually take it? And I'm going to tell you, well, look, if every day you do not eat that amount of meat, I'm going to actually recommend that you take some anti-inflammatory or colchicine. If you have gout, I personally would think that you should be on colchicine. Colchicine is not a problem for your kidney. So if you have gout and you have kidney issues, know that it is absolutely safe to take colchicine. And what I'm going to recommend is that you double the dose of colchicine. So if you take no colchicine right now, take 1 tablet. If you take already 1 colchicine today, take 2 tablets. You're trying to prevent inflammation before it even happens. If you know that when you're eating a lot of protein-rich food, such as like the turkey, I mean, the truth is, yes, the food during Thanksgiving is very rich. And so if you know that you're getting flares after Thanksgiving dinner, then let's prevent it. And what you're going to do is that you're going to take 2 tablets of colchicine. All right, easy, right? If in general you take naproxen or ibuprofen, just take it. Take it before you're eating dinner, or taking right after, or like while you're eating dinner, or right after you're taking your dinner. But what I want you to realize is that if the protein-rich food is what's causing, by breaking down, it's what's causing all of this uric acid, and because there's movement of uric acid, you're developing a flare. What we want is you actually preventing that. And so we're going to get you to preventing that inflammation by taking a little bit more colchicine, or by taking a little bit more anti-inflammatory. So by planning it in advance, okay? I'm having a comment here by Excedencias T108 that says long-term use of cortisol can cause degeneration of the bone. I have not said anything about steroids. I do not recommend steroids as a preventing measure. Absolutely not. And so I do not recommend steroids for gout unless you have tried already colchicine and an anti-inflammatory. So please know that none of the things that I've used right now are cortisol. Corticosteroids, so cortisol is not good in the long term, and we're not going to use that as preventive. That said, if you have a rheumatologist that you're working with, and they tell you this is the way for you specifically, that you're going to prevent gout, it's not my favorite treatment, but there's probably a reason why they offer that. Okay, so that's important. But I think what's important is to realize, and so this is what's important. And so when you're at that table, and maybe that's not you who has gout, but maybe your uncle, right? You have to tell them, gout actually, the flare up of the pain and the swelling and the redness comes when there is movement of uric acid. So if you're dropping the uric acid, or if you're going up on the uric acid, you actually move that uric acid, and that's what causes this inflammation. And so by when we're giving you colchicine, or when we're giving you anti-inflammatory, we're actually an anti-inflammatory, we're actually preventing that inflammation. And this is where it's important. We're not doing anything with the uric acid then, right? And so it's not during, I would recommend, if someone is saying, I want to start you on allopurinol, or, on Uloric, it's not the time to do this. Why? Because the allopurinol is going to move uric acid also, and we don't want that when there is a risk of having a flare. So in general, and you can look, I think I've done already some lives about how we treat gout, but I'm going to give you the big principle. But before we go into the big principle of how to treat gout, what I want you to realize is that you can prevent a flare. And the prevention of the flare is drinking a lot of water. Like, that's actually very important. If you're at a dinner table and there's a ton of alcohol, realize that you've got to drink water, water, water. And so a rule that my sister used to give me, she's like, 1 glass of alcohol, and they're the French one, it's much smaller, equals 1 glass of water, big glass. Okay. So just know this, right? Like, you want to drink a lot of water, and then prevent your flare by getting yourself more colchicine, more NSAID. Okay. So there's that. Then the thing that because you're probably wondering, and if you're in that discussion on the table, what you want at the end of the day in the gout, and that's a letter, like, it's not a instant action. What you want is to decrease the uric acid to a level that's less than 6 or less than 5, depending if you have tophi. Tophi are when there is how do you call that? Like, if you have under the skin some crystal, so uric acid is deposited under the skin, and it's usually at the top of your ears, around your elbows, but it can really be anywhere. But if you have like nodules, and if you're like looking at your ears and you're like, oh, I have some whitish spot, that will probably be tophi, and you want to have a uric acid that's less than the normal uric acid for just regular gout. Okay, so less than 5 versus less than 6. So if you have a high uric acid, you know that the goal is to lower the uric acid. The thing, though, is that if you're moving the uric acid, you have a risk of flare. And so what you want to do is that you want to start allopurinol with a medication that prevents a flare, right? And so usually what we do is that we'll give colchicine and allopurinol, and then we go up on the allopurinol until you have a perfect amount, like you're at goal for your uric acid, and we keep the colchicine or the anti-inflammatory until you're perfect, right? So that's why you back off only much later. And remember, right, so this is actually so important. If me as a rheumatologist can give you allopurinol that can give a flare, it's kind of like the same that if you were to eat during the table and you're eating at Thanksgiving. And so I'm preventing a flare by giving you colchicine, or by giving you an anti-inflammatory, right? And here's the thing: we can do the same thing if you're going to eat a rich food dinner. And I think it's time for us physicians to live in the present. And the truth is that I want you to have a normal life. I want you to live, and I want you to be empowered in what you can do. And here's the thing: don't wait for that gout flare to happen. Just go ahead, stop it even before it even happens. Okay. Hopefully this has been helpful. I see a lot of people are online. This is actually very exciting. Thank you. Thank you everyone for watching this live. I'm doing great. Thank you so much, Venkat Kari. Hopefully you are doing great. I'm from France. Where are you from? I'm from France, but I work in Colorado. It's my pure honor to have a practice in rheumatology that's direct care, where I work directly for my patients. And I'm very big on educating people, because I think that knowledge is power. And if you know what is happening to you, you can actually take care of it, right? And then what does THCC do to your body? I don't know what THCC, so I don't know. I'm so sorry. I do not know what your question is. I'm so sorry. And then I'm having a medical advice here. What would you prescribe to a 52-year-old woman with deformities in finger? Is that gout or rheumatoid arthritis? Such a good question. So deformities in your fingers can come from so many different things. It can be rheumatoid arthritis. It can be gout, like if you have severe gout, but it also can be osteoarthritis. It can be psoriatic arthritis. I think the most important question for someone like you would be: is it worse in the morning? Is it associated with morning stiffness? Does it get better with exercise? If it gets better with use and exercise, then you have an inflammatory arthritis and you've got to see a rheumatologist. If it's worse with movement, when you're like working and using your hands, and that's when it's worse, then it might be osteoarthritis. So in any chance, like if you're having a doubt, just go and see a rheumatologist. We're happy to see you. All right. And I'm just going to go on Instagram, like, hi, Melissa. Hi, Dr. Tanya Altman. It's such a pleasure to see everyone. Well, again, thank you so very much. Again, now you know what to say when you be at Thanksgiving dinner. And remember, like the goal of medicine is not to restrict you. It's for you to have a full and normal life. And if someone is telling you to restrict yourself, ask them, okay, great. Let's say I'm doing this. What other options do you have? Because I don't want to just restrict myself. That is not what we're here for. We're here for having a full and normal life. Okay. It's a pleasure. Have a wonderful week. I'll see you next week. Take care, everyone. Bye-bye.